And here we go. So today's talk, who's ever had neck pain in here before? I have. Everyone's, ow, my neck hurts. Just put my arms up. It hurts, right? Ow. Ow. Every day something. So how do we make sure we're doing the right things to step one, understand what neck pain comes from? So I'm going to go over here to go right into it. What's that? Me? Never. I enjoy it. These are fun for me. Okay? So I'm going to come over here, use the wall just for once. Here. Is I'm going to show you how I check with my patients when they have neck pain. I want to see one thing. If they're doing this, are they here when they sit for my first initial assessment? Do they sit like this? All of us sometimes do, but and some people don't know this type of posture makes their neck worse. A lot of people have gone through problems where they've done this for a long time, say their work, their life, and all of a sudden they wake up tomorrow and all of a sudden their neck hurts. You want to open the door or are you good? Good? Either way. At that point, they may do this for a long time and all of a sudden their neck hurts. So I want to tell them, this has probably been here for a long time, that position, this posture, how do we correct it, causing the main problem, causing their pain. So step one I have them do is go against the wall. I don't have a lot of room here, but we'll use this over here this time. So have them go against the wall. I want to see their upper body. I want to have them go against the wall with their heels, their hips, shoulder, and head, and see arms relaxed on your side. Does this feel good to them? Or does this here, some people will say, this feels like they're going too far back. Why would that be? If their body is used to this as their normal, this is their straight. This is what they feel. This is what they feel is their good, right? Their default. So go back here is going beyond what they're used to go, I feel like I'm going way too far back. So I have to help them understand this is good posture. This is where we want to get to. Even though you may feel uncomfortable here, can we change our brain's perception of what normal is for you so our body's structure mechanically get to here where things stay more open, relaxed, and loose, so we're looking at the ground all day. All right, just takes time. Maybe sitting, maybe standing. We'll go over that one too, what we're going to do. But we're going to get our body back here. That's going to be the goal with these stretches today. Also exercises too, so you feel stronger, relaxed, and happy. Not like this, all day. Too bad. No. All right, so number one thing, posture. When I do this assessment too with people, I go, when you do this, what feels uncomfortable, what feels sore, what feels painful? They'll say, my neck hurts back here. Okay, I'll give you that. Sometimes even causing headaches. Sometimes, so secondary symptoms, headaches, even shoulder pain. You feel like some people feel like they're being choked on their neck. Why is that? I'm not a spiritual person. I am, but not that type of spiritual person. Is because these muscles will tighten up when we're here. If my body's here long enough, my muscles will adapt to make this my normal. My scalene muscles then shorten, my SCA muscles shorten too. So now this feels like it doesn't feel, over time doesn't feel good to them. So we'll make sure everything stretches backwards. These shoulders drop down. If their shoulders are turned in, get that turned back out again. So their whole upper body goes here and feels relaxed, normal, stretched out, and strong versus here. Then I can sit and work all day. I can do whatever I want to do and feel like I can go back to here again as my normal. Just takes time to reset the brain, the cerebellum. At that point, get our brain to reset, and then our body can feel better. Right? Any questions so far? Nothing? Again, different types of neck pain causes from non-traumatic, sitting too long, bad posture, normal. That's more common. Sometimes car accidents. Okay, can happen too. More trauma-related or a fall. Can happen too. Or from previous, I had someone come this morning, previous car accidents, whiplash, now 3-4 months later having neck pain. Everything healed this way instead of this way. Just takes work. All right, so number one thing to do is here, is called an upper trap stretch. You can all do this with me together if you want. I call it simple because I do it every day with my patients. Do it with you guys here. Just camera around a little bit. Right here. Is what I have you do is if I want to stretch, if these muscles here in my shoulder are tight, okay, they've actually shortened to make everything stay here. I want to make those muscles now lengthen. So the upper trap muscle is from your shoulder joint to your neck. And when I say neck, base of the skull, right up here. My hairline-ish. I'll get my neck cleaned up tomorrow, hopefully. There. Along with the upper trap muscle here, right back here in the shoulder joint, right in that area. So I want to make those muscles there in that area. I want to stretch them all out by one simple stretch. I call it simple because that's how I tell people. I'm going to stretch my left muscle, and I'll go in the right second too. Bring my hand behind my ear. I'm going to turn my head to my left shoulder, then bring my head, just the weight of the arm, down toward my body to feel that stretch. Good, perfect. So left hand again behind my left ear, my right hand behind my left ear. Turn my head to my left shoulder.
Your right hand before you.
My right hand behind my left ear. And then turn my head to my left shoulder. The weight of my arm, bring that down to my body, my head down. You'll feel that stretch wherever that muscle is tight. So it can be tight at your shoulder, upper back, or at the base of your neck. So same thing for the right-sided people here. Bring my left hand behind my right ear now. Turn my head to my right shoulder. Head down toward my body. Let the weight of the arm just kind of pull that down. Feel that muscle really stretch. And hold that at home 15, 20 seconds on both sides. Do this throughout the day. Comes down to very simple. Any questions about that?
Where would I feel the stretch? I know I just feel it here, but I was feeling it right here too.
So you would feel that whole muscle, wherever the muscle feel is tight, would be here, here, or here.
Okay.
If it's tight here, that means your shoulder even rolled forward a little bit too. Get everything coming back more.
Okay.
Yeah. It'll be right there at the base of the neck. We're all tight somewhere, so I want to make sure you get those muscle stretches out. So simple stretch to do, both sides, 15, 20 seconds. Do them throughout the day. The other one's going to recommend doing them probably a couple times a day minimum to release that stress throughout the day. Who has pain with their neck in the morning? Anybody? Good. So I recommend stretches. If you have pain in the morning, recommend doing your stretches before you go to bed. Pain end of the day, stretching before you go. Stretching end of the day would be once you go to relax, say maybe 4 or 5 o'clock, then stretch right away. Morning's good too, but at least at night and evening to make sure, because the problem is our facial bones and teeth are not an even bowling ball. It's not even. Most weight's in the facial bones and teeth. That point to push their head down all day. So naturally push here versus staying back here. We'll learn over time. Yes?
When I wake up, a lot of times my shoulder hurts.
This shoulder here. I'll give you a stretch for that one too. So if you feel your shoulders are doing this going forward, you want to make sure that shoulder comes back more. So if you wake up in the morning and you feel that shoulder being tight, go on, I'll show you in a second. It's right here. I'll just go right into it. I like to demonstrate stuff. I'm a demonstrator. Not on the street, I'm not like on strike or anything like that, but here, right shoulder, I'm going to lay set aside my bed, and just like this, my shoulder drop on the side of the bed. Either with a water bottle or without a water bottle, they just kind of hang there, because what happens with our shoulders, they wind up like a piece of rope. You want to unwind everything back. So again, we talked about before, secondary symptoms of neck pain and shoulder pain.
Excuse me, Doctor,
Yes.
because we are in bed, we have to use the pillow.
So I would line the edge of the bed, but don't fall off, because I would feel bad. And just bring your arm on the side of the bed. Let it hang right there. Letting gravity push the arm back, or use a water bottle for more weight. And as you do it too, first time you do it, might be a little sore, so keep your elbow in. As it gets easier, then bring your elbow further out to get more of a stretch. I tore my shoulder before, so I went through all the rehab myself. Yay. Good times. It just takes work. But doing the right things over time every day allows you to feel better tomorrow. People that have shoulder pain also have neck pain because it pulls on the neck at the same time. It's a combination of both. All right? Any questions about the shoulder stretch or the upper trap stretch? Any questions? So again, just one more time so you can see it. Right hand behind your left ear. Turn your head to your left shoulder. Weight of the arm pulls the head down for the left upper trap muscle. Want to switch sides now. Left hand behind your right ear. Let the weight of the arm pull it down to stretch your right upper trap. And 15, 20 seconds both sides. I like morning and night, but even throughout the day, if you feel you're doing a lot throughout the day, just bring that head over. Stretch that neck. Next one, pillow stretch. Okay? This is pillow stretch. Even though I call it pillow stretch, I use a bath towel. Simple stuff. You know, I have one of those half pillows at work, but here. So here, I'm going to move this out just a little bit. Here, I'm going to do, if that's in your way, let me know, please. I'll try to get out of your way. I want to do is get that neck here, that neck further back behind my body. So if I'm sitting a lot, what's going to happen is like the wall, my neck will go in front of my body, not stay back here. So, but if I do this all day long, I'm just stretching the muscle, not the ligaments in your spine. So your spine has ligaments connect bone to bone. Want them to stretch backwards, not forward, to release that pressure. So how do we get our muscles out of the way when we stretch? By lying down, they relax more. So what I'm going to do, I'll go right into it. I like the bed because it's hard to get off the floor sometimes. Just be realistic, right? The floor is not easy sometimes. It's especially end of the day, right? You get that? Well, I'm 50. I'm 57, so end of the day, I'm going like, once I sit down, I'm like, gravity's so much heavier at the end of the day. So I want to make sure I do everything, if you can, on the bed. On the floor, if you like the challenge, go for it. But you want a hard surface. Okay? If you do it in bed, you can. Just add a second bath towel because you're going to sink into the bed a little bit. All right? So just a normal bath towel. Mine went from one beach towels, I guess, from whatever. I'm going to go right here. I want my head to fall back behind my body. So what I'm going to do, I'm going to put this towel at the top of my shoulders and let my head fall behind there, just like this. Boom, and right here. Just like that. Magic, right?
So you put the towels right in your shoulder.
Right, exactly, right on my shoulder, perfect, Mia. Just on my shoulders right there, head fall behind there. That point, letting my body relax, muscles out of the way. Now your spine can actually stretch backwards in extension, coming backwards more, relative to being forward, going this way. If that's comfortable, hold on. I have something else to tell you here. Now you can do is now bring your arms above your head to stretch your shoulders also at the same time.
Bending knees.
Bending knees. I like bending knees, helps take the pressure off the back, yeah. That point here, that point stretch your shoulders at the same time. So 1 minute here to start. Arms at your sides or across your body. Second minute, arms above your head. Just like that. Magic, right? But you want to relax in the stretch. You don't want to stress yourself out. Just relax. If you fall asleep, you fall asleep. All right? Any questions on that one? Pillow stretch.
How long can you sleep in that position?
I wouldn't sleep because it would be too much of a stretch. I would do maybe the maximum 4 minutes, 2 minutes with the arms across your body, and then 2 minutes with arms above your head. If you sleep in this position, it'll be too much of a stretch. You'll be more sore the next day. You'll call me and go, you hurt my neck. No. So only 4 minutes total maximum, but start with 2 minutes. Yes?
Do you have a recommendation? You can tell me later if you're going to get to that. What kind of pillow to use if you got
Pillow?
big problems and stuff?
Pillow, firm pillow, a smaller size.
Not one with a wedge here and
No.
a flat there or something?
Most people that have a neck that's in pain is going in flexion more, going forward. If you try to force, right now you're happy here. The problem is you're happy here. Let's get your neck further back over time by having a flatter pillow more firm. There's more support. But making sure we replace our pillows every 6 to 9 months, and just a medium weight pillow from Target, Walmart, Sam's Club, Costco, wherever. And I don't sell pillows. It's more of your comfort level. But whatever you're comfortable, get the neck further back by having more of a smaller, firm pillow. I had a patient come back. Quick question. I had a patient come back from Japan 2 weeks ago, and was there, and he says, "Man, I felt so good that I had no neck pain, back pain, because their beds are so firm. They're not very thick, but firm, and they're solid and heavy too. Heavy too. Yes.
Is it bad to go without a pillow?
Not bad. If you can have a pillow in your back sleeper, go for it. That's the best without a pillow.
What about if you sleep on your side sometimes?
You want something to where your side sleeper,
You know, it's like straight. Yeah.
you almost want a pillow that measures from when it's pushed together, pushed down, We're measuring between your shoulder and your ear. Whatever keeps you comfortable here, so you're not doing this, causing a strain on this side, or too far up, pushing too big of a pillow, pushing strain this way. Let's got to play with them a little bit too.
Yeah, thank you.
Welcome, of course. Yes.
Are those contour pillows good?
Be careful with them, because if you have a neck that's a good neck already, at that point it'll maintain that. But if it forces, like we talked about earlier, doing the pillow stretch too long, forces too much, it'll cause more pillow strain. So if my neck is like this, where it's safe, where it's very straight, and I go maybe 10 degrees, I'm okay with that. But if you have to go 20, 30 degrees, it's too much of a strain. So you have to be careful, because if your neck is pretty straight and you try to get a big curve out of it, this isn't going to be very comfortable for all night long. And people ask me, like, should I sleep on my back or my side? You can sleep, I'm okay with either one, even your stomach too, but making sure you're comfortable with that position. Just time, figuring things out, all right? Any questions yet? Anything else? But good question. This is about your questions I'm going to help you with. This is why I'm here. You have questions that may not be on the sheet. I'm okay with that. I know, don't tell my wife, but I do know everything. Okay? Well, you know. Just don't tell her.
So I have a question.
Yes.
If you have a smaller, firm pillow,
Yes.
where that goes right here.
Oh, good. I would put the pillow, okay, this is my disclosure. I'm not an artist. I have very artistic ability. But here, if I was to take someone's pillow, right? Just say here. Okay, that's normal pillow. I want your head here position-wise at more the top here. So at that point in your body, say your shoulders are here, okay, and your shoulders and stick figure arms, okay. Your body's more like that, where your head's on top of the pillow, not in the bottom or the middle. Support your shoulders as much as your head. So your head and shoulders, like the commercial, should be at the same level, not here, not here. Does that make sense to everybody? Yeah, crazy, huh? You want that support for your body and head. You don't want, like standing on the wall we did a second ago, want things more level there, not too far forward, not to the side, not too far back. Yes?
So you basically want just a flat, firm pillow, not with these,
Exactly.
cave-ins for your neck.
No.
Okay. Thank
And
you.
they make special ones that I've seen that do work for some people for the side ones. They might work. Just make sure you keep your receipt. Try it. Try it like was it the old commercial, Mikey? Try it.
Yeah.
Try it. But that's all it is.
That was a perfect explanation.
Like that? Like picture, maybe not. You guys use your imagination about the picture.
Great, yeah.
That's what I do. All right? I'm a stick figure person. Now, 3 shoulders. I may have someone help me with this one in a second too, so you can demonstrate it with you. Let me move this out of the way. Get over here and use the wall over here. Give me a second. I will need the wall for this one. Here. Here. I like this one. Once you feel those first 2, that's why they're separated, is once you feel the muscles in your neck and shoulders are more tight than painful, then move on to strength exercises. If they're still tight and painful, if you try to strengthen them, it might actually cause more injury. So give yourself a range. Okay, if it's not tight or painful, how to work on some strength. Okay? So number one thing I have people do, work on strength here on the shoulders. Right here. Hope I'm not in anyone's way. I take 2 water bottles. Ooh, Easter egg back there. Perfect. 2 water bottles. Just see some in the corner. Let me get that way a little more this way. Here is I take, and this doesn't have to be Costco. It can be any brand you want to use. I just want to let you know. Here, elbows in. First one I want to do, we talked about a second ago, right? If I have my neck's forward, where's my shoulders? Are they back or are they forward? Forward too. Sorry about that. Let's make everything come back more. Unwind the shoulder, get things to open up instead of being forward. All right, so first one, 3 shoulder exercise, now 1 of 3. Elbows together. Your now is come out, wherever you're comfortable, then come back in. So again, you want to pause For me, because I do them every day, here, all the way out, hold for a second, come back in. All right. Number 2 of 3, we get that shoulder here. When we're here, our anterior delt pec minor shorten. We want to lengthen them over time, open them up. So number 2, you now is take those water bottles, elbows about 90 degrees to your shoulders, parallel with your shoulders, 90 degrees to your body. And same thing with your hands to your elbows. Now come straight back, hold for a second, then come down just parallel to the ground. Just right there. Up, hold for a second, then come back down. All right. That's number 2, to open up that shoulder this way, not just this way. All right. Last one. Here, instead of being flat on the wall, you want to give yourself a little more room to work with. Feet off the wall, just a little bit, leaning forward. And now drop the weight, drop your water bottles or weights straight down. Then from there, bend your elbows just a little bit. Little chicken wing. Little chicken wing right there, okay? Then from there, bring your hands straight up. Hold for a second. Then come straight down. The reason we want this one, I want to make sure if my shoulders are here, is my upper back strong or weak? Weak. My upper back's in this. Ugh, I'm so weak. I want to get my upper back stronger, so as I come up, I'm going to pinch the back of my neck here with this one. With this one here, the second number 2, I'm going to pinch more down here to get that to tighten up. See all my muscles flex? Just say yes. I worked out today. Just say yes. Oh man, woo! It's like a bodybuilding show over here. Number 3, I'm going to do now, say not first one actually, I'm going to bring my hands out, but also make my whole back pinch together, just like that. See that bulge out? I need bigger shirts. I'm going to rip my shirt in a second. Is that okay? Yeah. Hold that, elbows in, come all the way out. All right? Who wants to try this? Put up. Of course, yeah, of course. Might as well. Might as well. What's your name?
Marcy,
Marcy, Tony.
nice to meet you.
Nice to
Very
meet you. Sorry, the water bottles are cold.
That's
So grab a seat on the wall. Right there. Feet against the wall. Way back.
Way
Perfect.
back.
Yep, perfect.
Oh.
Yeah, of course. Woo, look, so much fun. So much
I
fun.
feel like I'm going to fall that way.
Perfect. This is a better balance position. So if you go, we'll talk about the last exercise we're going to talk about too for long term to help your body fix posture. So where you are now, elbows tucked in. Marcy right there. Elbows come straight out where you're comfortable. Perfect. Where do you feel that stretch?
Yep.
Perfect, right in front.
Yeah, right there.
Up here in the or the pec minor, anterior delt, right there on both sides.
And right here.
Perfect. So the bicep too is tight.
Yeah.
Good.
It's tight.
Biceps tight. Hold that for a second. Marcy, come back in. Does that feel okay?
Mm-hmm.
Let's do one more time. Elbows in. Perfect. Good. Perfect. Good. Come back in.
It's tight.
Now elbows, shoulder height. Boom, right there. Perfect. Hands 90 degrees out here. Other side too. Make sure they match. Now here we're going to do now is come up, straight up. Boom. Hold that for a second. Then come straight down. And try to keep your elbows and the shoulders level. It's harder. Sorry. Come on up. One more time. Bring them down. Come one more time. This time, make sure we smile this time, okay?
I'm still not wanting to fall forward.
That's okay. It takes time. Takes time.
Sure it does.
Good. All right. Last one, Marcy, have you do now is bring your feet forward for me. One more. Hips against the wall. Good. We're going to lean down. Drop the water bottles, head up the whole time. Chicken wing a little bit. We're going to come straight up. Here. Perfect. Good. Yep. And then head up.
Oh, that's right.
Yes. And down. All the way down. Let them relax. Come up again. And pinch those blades together. Pinch that neck.
Ooh, yeah.
There we go. There's the ooh.
Feel it.
Come on down. We have to work the muscle. Come up again. Don't forget to smile. Perfect. See? You feel better when you smile. We all do. Come up one more time. Perfect. Good. Does that feel okay?
Yeah, that's
Woo.
tight. Yeah. Ooh,
Just
right.
water bottles too.
Yeah,
So-
these are heavier than you think.
You think? Right? Actually, look, you're not done. No. You're stuck here now for the rest of the workshop.
Okay.
Kidding. So now, We talked about being off balance, right? So where you are now, keep your heels against the wall. Let's work on some balance stuff too. So take a step forward for me. Put the weight on your heels. I want you to, this is the bonus one for you guys, okay? When we walk, can we walk more upright to reset our posture versus where we feel comfortable? If I'm here, this is my straight. This is where I feel comfortable. So Marcy, what I want to do is go against the wall one more time. Take a step forward now. Weight on your heels. We're going to start walking heel to toe this way, heel to toe, just like that. Body up here the whole time, and not on your toes or your forefoot. So take 2 steps forward.
Do I also bring my hips in? Because sometimes we want them out, you know what I mean? Or I catch myself.
What do you mean? More like in here, or where do you?
Yeah, like right here, I want to go like this, but then I can also go like this.
No, good question. Good, I didn't realize that. So you want your hips to come this way, more an
Yeah,
extension.
that's what I thought, okay.
Extend out a little bit. Then from there, so you want to extend, you're not going to extend out, but get the muscles that really fire to pull you out.
Okay.
When they fire, then we're going to walk just heel to toe, keep your head up the whole time too. So we're here, not here. We don't want the hunch, we want more extension. Take a couple steps forward. How does that feel? You look great.
It feels strange because
Yeah.
I'm not used to doing
Yeah,
it.
yeah. If it feels uncomfortable, as you do that long enough, then your body will reset everything to make that you're comfortable.
Yeah. And then
So reset.
I feel after doing the wall exercise, I feel it's still pulling a little bit.
Perfect.
Through here.
It's more muscles being stretched.
Oh, okay.
So I would recommend doing these every day. Start with 5, boom, 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 and then as you add more and more, work up to 10.
Oh, okay.
And when should we stretch? When's a good time of day for you?
In the morning.
Perfect.
Get up.
I'm a morning stretch person. That's when you get yourself done. So end of the day, you're like, oh, I'm done. Go right to bed.
And one of mine was this, but I didn't put my heels all the way back. I was like this.
It's okay. It's okay. You'll get used to it.
But I'll get used to it, yeah.
All the way back. Hold for maybe 10, 15 seconds. Okay, now I'm going to step forward. Keep my muscles strong in my lower back. Shoulders back a little bit and down. Chin back a little bit also. So we can walk this way, feeling uncomfortable, to becomes our normal. Our muscles need time to adapt to here. And our brain, again, your brain is where your center of gravity is. That's where it comes from. Tells your body where to go. As you do this more, your brain will feel a little bit uncomfortable until it becomes your comfort level. Just work.
I also have a little bigger behind, so I
That's
can
okay. It'll help you counterbalance. It's fine. You're counterbalance.
positioning me
Yes.
that way. Okay.
It just worked, Marcy. Thank you.
Thank you.
Thanks for coming in. Yes.
Question about walking and how to look so you're safe on the ground.
Good. So we're going to talk about before too. If you're looking down here, I'm blind down there, right? So what I'm going to do is look over my nose, look down my nose this way with that peripheral vision, using that vision to see what's in front of me. So not this, that's straight with your eyes. Looking down over your nose allows you to look this way so you can walk and look in front of you as much as you can. Again, if you need to, look down a little bit, but still keeping your chin back, not here. That's the plan. There you go. What have you got to do? Yes, sir.
2 questions.
Yes.
If I recommend those bands to pull you,
I'd rather when you use the bands holds all the tension and weight. There's no muscle change to make your body want to change over time. Unless you have an injury or something. I have a guy right now I talked to today, he had shoulder surgery. He needs to wear something, a sling or something like that. But if you don't have surgery or something, your brain needs the tension and the load to feel different so your brain can rechange everything. Brace is doing the work, then you're just here again. So unless someone has issues, I would recommend not doing the band.
and the other question
Yes.
is, once you feel comfortable with water bottles,
Hmm?
can you,
Go higher.
okay.
This is probably
What would you recommend the highest?
maybe 10 pounds.
Okay.
This is more of, yes, some weight, but more making the muscles back here and back here move more for the positional change. It's more of the change of a little bit of load, more change, so the muscles wake up to hold your body down here. Yeah, as much as you can where you feel comfortable here, and here without causing more strain. So maybe for you, maybe 100 pounds. You look like a tough guy, so I just want to make sure.
You don't want to ask her too hard.
Exactly. Yes.
Can you explain something about the neuropathy?
Neuropathy? What sometimes people with neck pain, they have something called neuropathy. Neuropathy is where it runs from the neck into a different area, either in the head, causing headaches, which is nerve pain, where it can pinch in the spine, make that nerve want to run to the head, causing headaches, or it can go down the arms or down the back. Neuropathy is about 4 different things. If you feel burning, tingling, numbness, or sharp pain. Burning, tingling, numbness, or sharp pain, that's more neuropathy, more nerve problems, not just muscle problem. So when someone tells me, yeah, I have neck pain, but I wake up in the middle of the night and my hand's numb, I go, ugh, nerve running from the neck down the arm. We get more neuropathy when we don't move than when we move. So moving more and getting your head further back makes that spine open up to take the pressure off the nerve.
So what happens you have more in the left side?
So you have more neuropathy on the left side. So you want to make sure you bend that head to the right to make that spine open up on the left. Again, I have answers for everything, Maria. That's what I do. So yours, make sure you do your stretches before you go to bed. And when you have neuropathy too, you want to use ice, not heat. Ice, not heat for neuropathy. Muscle, heat's great. If you have neuropathy, again, burning, tingling, numbness, or sharp pain, you want to use ice, not heat. All right, good. Remember? She knows. Yes.
I already know I have spinal stenosis really bad in my neck and my lower back. So does some of these stretches aggravate it more, or should I not do?
Is stenosis in the actual side canal of the nerves of the spine, or is it in the spinal cord?
It's in the spinal cord.
So you want to focus on it. So you want to focus on extension exercises to open up that spine.
Oh, okay.
Extension would make that spine want to open up more, take the pressure off that nerve.
Oh,
So the pillow stretch for sure would work for you. Just figure out how much height you can do where it doesn't irritate it.
Now the ones you just showed me that was up there, I can do those.
Go for it.
Okay.
Yeah. If you can stand up there and bring your arms up, go for it.
Yeah. Okay.
It's that you don't want compression,
Right.
and that's going to be more distraction to open the spine up, not closing it off.
Oh, okay. Thank you.
Of course. Again, I have answers for everything. Just don't tell my wife. All right. Now, shrug exercise. So if we can do this exercise where this feels good, okay, I want to focus on now making these whole muscles back here of your shoulder, upper back and shoulder, stronger. I want to give you strength to handle sitting for long periods of time. That's my plan. Even standing long periods of time too. So what I want to do with shrugs, I call them modified shrugs. Shrugs are normally like this, straight up, straight down. Okay, boring. I don't like boring. I'm going to bring my hands. I want the whole arm to open up here, right? Even here. So what I want to do is start with your hands being more open to get that posture come back more in extension. What I'm going to do is have you come on the wall to start, come straight up and straight down. Whereas my head against the wall for the most part, I'm not doing this. I want to do all my exercise in good posture. So I'm going to head against the wall, bring my hands straight up, pinch the back of my neck again, right back here, let it pinch, hold for a second, and then drop it down. Maybe about 10 of these at home, just water bottles. If you're comfortable with it, now come off the wall. If you have good posture and good balance, maybe spread your legs a little bit wider. Now here, I want to come up, but I also want to roll my shoulders back a little bit, then come down. Focus on a second plane rotation. So up again, hold, rotate back, and then come down. Work more of the muscle this way versus the one plane area. More rotation, more movement gets things to really drop. So you can sit here, not feel like we're doing this. Now using more secondary muscles, upper back, rhomboids, even some pec muscles to really come up, hold, rotate back, then drop back down. And you can do heavy weights with this one too. These will be kind of too light sometimes to go heavier weights. You know, I do like about 600 pounds. Boom, like that. You know, but it takes work, it takes time. It doesn't happen overnight. I wouldn't do forward, not for the neck issue, because forward would still mimic this posture here. So it'd be straight up, good question, and then straight back, and then straight down. Or if you feel comfortable, up, and then just rotate back and down. And again, we should also, when we're doing this, we should smile. Work with me, people. Yes. Yes.
What's that snapping?
Yeah, it's like here.
That's pressure in your neck and your shoulder. Sometimes you'll get that here with your shoulder blade attaches to your spine. You'll feel some of that rub a little bit in that area. The muscles are tight. You even feel it back here in your shoulder blade back here in the shoulder, because that means that shoulder's tight in that area. So making them looser will take that pressure off. Yeah. You know, it's something to where you need more motion. Ligaments get looser, then the pressure comes out of your spine. All right, so again, up, hands open the whole time, and roll back down. All right, last one. This is a good, yes?
They said there are some physical therapists, they talking about at this age, we can know lifting heavy weight, especially for my age, no more than 10 pounds, and if that is correct.
No. We have to lift enough. If you want to stay in bed all day and not do anything and feel like you're getting weaker and weaker, lift just 10 pounds. But if I want to get stronger, I want to lift as much as I can where I feel uncomfortable.
Yeah.
I want to make sure if I want to get stronger where I can handle my day, I want to feel like I'm pushing my body. If I lift enough weight to go, yeah, that's fun, good times, yay. I'm doing nothing to my body, causing no change. I want to feel like I'm causing a little bit. I can hear a lot. I hear from medical doctors, orthopedists, from physical therapists, even acupuncturists also, to even chiropractors too. The problem is you're playing it safe, causing my body to become weaker and weaker and weaker. I want to get strong. I had a patient, Rachel, about probably 3 years ago now. She came in my office, quick story, and she came in, she said, my back is killing me. I have neuropathy. Like, she came in a wheelchair. I go, okay, let me see if I can help you. Took her x-ray of her spine, take x-ray in my office, and I go, Rachel, your x-rays are fine. Why are you like this? Well, my doctor told me 6 months ago, if it hurts, don't move.
Oh my God.
If it hurts, take it easy. Get weaker, tighter, weaker, and tighter. So unless you have a spinal problem, unless you have a medical condition, you have bad osteoporosis, bad something, you got to push your body to stay stronger. So for example, if you feel this feels good to you, and then, okay, that feels good, it gets a little uncomfortable, let me do 2 more. To get strong, we have to stress our body. Unless there's something medical going on, I want to make sure you're stressed. Even with stenosis too, same thing. Push your body to feel strong. If we lose our strength, what happens? We need help. We lose our independence. Anyone want to do that? No. No. Stay strong to stay independent. But it takes work, uncomfortableness. Sometimes you're a little sore. Sorry. We have to stay strong. Does that make sense? 10 pounds is 10 pounds. Maybe some exercise. Maybe that's a little hard. We could do these 10 pounds, yes. These 10 pounds, yes. If we can walk down the street, we're using our body weight to help our lower body stay strong. We need our upper body to stay strong too. It takes work. No, I don't like that advice. Sorry. If you want to, take one of my cards, whoever told you that, have them call me. I'll tell them different. They'll never call me though. They get scared of me for some reason, I don't know why. Now resistance band. Okay, you can use this fancy one if you want. Some fancy band if you want. It's up to you. You can use your belt. What's that? Yes, you want. It's up to you. You want to work on extension. You want these muscles back here, stronger. The back of from your base of your neck to your head. To your shoulders stronger. So what I'm going to do is take that band. I'll make sure to do my hair again before I go back to work. Sorry. Here, take that band. I'm going to go here, and I'm going to do here. Just sit there, nice and relaxed on the edge, so I don't fall off. At that point, let my head hold the band right there with 2 hands or 1 hand. My head comes straight back. Okay. My goal is to push my chin straight back with the band, just like that. Not a tilt, but a straight back, one plane. There, hold, then come back forward. Hold for a second, then come back forward. So same thing over here. On this side too, you can see that. Here, straight back, hold for a second, then come forward. All right? One more time over here. From the other angle, straight back. I'll hold this end. Here, straight back, push, hold for a second, then come forward. All right. Any questions about that? I'll use my belt, but my pants would fall off. That'd be weird. All right. Any questions? Maybe start with 2 and work up to 5. Will it make the muscles sore? Probably, because you have to get stronger. So I recommend, again, just to go back, always start with posture first. Make sure your posture is good. Okay. Make sure once it feels good, upper trap stretch both sides, 10 to 15 seconds. Just one stretch. Pillow stretch, start with 2 minutes, work up to 4. With a rolled up bath towel. I like in bed because it's hard to get off the floor. 3 shoulder exercise, you start with water bottles first. Work your weight up if you need to. Then also the shrugs, water bottles. You'll probably want more weight than that also. And then next extension with a band or a strap or a belt. But again, number one thing, can we walk with good posture using the wall over time? So like Marcy, correct?
Yes.
Marcy, we stay back here standing versus here. Yes, question?
Let's say you don't have a band, can't you just go like this?
You can, yeah, you can. Not gonna hurt you. But making sure again, this is something where if you feel you want more strength, use a band or use a belt. Last thing I'm gonna give you, because I gotta get back to work in a second. How do we sit? Uh-oh. Uh-oh, now what do we do? Uh-oh. Uh-oh. Most people, when I test for sitting, they sit like this, use the back of the chair, like this, right? Feet forward, body back, back arch this way. That's normal. If I want a better neck coming backwards, less shoulder pain, less upper back pain, I want to do, number one thing, slide your body forward in the chair. Hold for a second. Then we want to do is now bring your knees below your hips by bringing your feet either underneath the chair or behind the chair so we're more upright. Ugh, ow, ugh. By doing that, now your hips can clear going forward, your back can arch because your knees are below your hips. But when you do this also, you're going to feel like you have better balance, or your balance will be off because you're not leaning forward as much. By having your body here, you're more in line like the wall was a second ago, more in line here. So now your head will slowly and naturally fall back with your shoulders. So you want to lean back more, activating your core and your back muscles, and your shoulders stay rounded backwards, versus here we can naturally, as you're in bad posture, lean forward easy. Here's more active sitting, contracting the muscles like you would on a ball, for example, versus being more passive where we're relaxed. All right? When you do this for a few times, your back might get sore. I'm sorry, you're getting stronger. Apologize. But get stronger to feel better so your body can sit here, stand here, instead of being here. Boom.
Can I put my arms back too?
You can,
Sometimes I
yeah.
do that to
You
stretch
can.
those out, yeah.
You can. I just can't check my tic-tac-toe if my hands are behind me. Or my face camera Instabook. One of those ones, whatever it is. All right? So here is more better position. Keyboard here if you want to. You want your head, if you have a screen on, head more level too. So your head almost sits back more versus forward. All right? Any questions? That's my bonus one for today. Whoever didn't show up doesn't get that one. Any questions? So when you walk out of here, a good posture, and take this home. If you have a sheet for one too, practice these.
I need a massage now.
I'm just a chiropractor. You guys have a good day. Thanks for watching. Thanks for showing up and doing it. Any questions, let me know. All right? You want? Of course. Yes.
Thank you for coming up that city.
I was like, let's go. Oh yeah, perfect. Oh, so it says you doubled up today. Good. Ooh, perfect. Yes. Give me 1 second.